As all of us grow older and Maine has the oldest population in the country, healthcare becomes more and more important. It's expensive, sometimes hard to find.
In Camden and 3 neighboring towns, some older folks have been getting a special kind of health care to keep them out of hospitals or nursing homes. And as 207's Don Kerrigan found out, they've been getting that care for a very long time.
At a quiet address in Camden, Judy Lydon goes to work. She is an RN with Camden District Nursing.
Good morning. How are you?
And home visits like this are what they do.
So how have you been?
Good.
You had a good week?
Excellent week.
Perfect.
She visits Virginia once a week, tracking vital signs
12 noon.
And reloading medications into the pill dispenser.
And 8 o'clock at night.
It's all basic healthcare stuff, says Judy.
Beautiful.
And it's needed.
We give them what they need to stay safely in their own homes and age in place. That's not provided within the healthcare system.
Virginia says she began using Camden District Nursing about a year ago and now finds Judy's visits essential because area doctors change so much.
It's not a good system. And the individual doctors may be good, but continuity is worth a lot, and there's no continuity. So the continuity really is Judy. She knows what's going on week to week.
Judy grew up in England and was trained as a nurse in London.
Worked in various London hospitals, and then before I left, I was a nurse manager at Guy's Hospital.
She later worked in some U.S. hospitals, then moved to Camden 15 years ago, where she discovered Camden District Nursing.
And then when I saw what they did, I thought it was fantastic. It was more like my nursing from England, more hands-on.
And payment here is also a little different. No health insurance, no Medicare, and a reasonable bill.
How much?
$30 a visit.
If they can afford to pay it.
If they can. If they can't, then we bring that down to whatever's manageable.
This small nonprofit relies on donations, grants, and bequests to cover the rest.
Now, you might think this is a modern innovation in healthcare. You would be wrong. Camden District Nursing has been doing this work for 104 years.
It was founded in 1920, right after the Spanish flu pandemic, with one nurse to meet local needs. Camden District Nursing now brings care to homes in 4 area towns at all income levels. They don't deliver babies anymore, and the work is focused on older people, all to help those patients stay in their own homes as long as they can.
Honestly, we've been around for 104 years, and for the longest time I had no idea that we existed.
Camden native Nancy Dowling discovered Camden District Nursing after she moved back home. She's now the board chair.
How necessary is this service?
Vital, especially these days, really vital, more than ever. And I don't think it's just the demographics have changed. It's just that the whole system is pretty hard to navigate. And I know that the nurses and our very competent office administrator help families just navigate the system.
Rich or poor, she says, mansion or mobile home, doesn't matter.
Does it ever surprise you that here we are, that 104 years later, it's still here?
It is a little surprising, yeah. But it's obvious what the demand is. The need is very much there.
And that need extends to medical equipment, walkers, wheelchairs, even hospital beds, loaned out by Camden District Nursing for free. Office Administrator Lisa Payson runs it.
If we have what you need, you're welcome to it, and then when they're done, they return it.
Does it feel good to be part of something like this?
Oh my gosh, I can't tell you how it feels to be part of this.
That's active patients that we have on file right now.
How many?
115 at the moment active. It's a lot. December already.
There are 2 per diem nurses who fill in occasionally, but most of the workload is on Judy. She also manages and does fundraising, but caring for all those patients is job one.
Have you ever had to turn anybody away?
No. I really try not to do that, because if they have a need, they have a need.
They do need another nurse to give Judy a break and hope there will be money in the budget to do that next year. They also hope there will be someone wanting the job, because the need does not stop.
You become an important part of their lives.
It is. We really do. It's very special work.
Camden District Nursing is one of just 3 district nursing services in Maine. There is one in Rockland and another very similar one in the Booth Bay area.
Each provides affordable care in the home, all depending on local donations and support. And the folks at Camden District Nursing say they think it's a model for other communities that they should try to follow.